Hi Julia, welcome back to the office.
Hi, thank you.
How are you doing?
I'm doing okay. I am coming in because I have some facial pain. It's here, mostly. And then I also have a scratchy throat. It's been really bothering me the last 2 weeks.
I'm sorry you're dealing with that right now, but I'll do my best to try to figure out what's the cause.
Thank you.
So you said the facial pain and scratchy throat started 2 weeks ago.
Yeah.
Do you know if anything could have brought this on?
I can't think of anything.
Have you had an accident, injury, any kind of trauma to the face?
No, nothing like that.
Okay. What about a viral or bacterial infection?
No. I don't believe so.
Okay. Have you ever had this kind of pain before?
No, this is the first time. It's weird.
And the scratchy throat? Have you had that before?
I've had that before, but it always kind of went away pretty quickly.
So this is the first time it's lasted 2 weeks?
Yeah, exactly.
Okay. Okay, that's quite unusual.
Yeah.
Now, how would you rate let's start with the facial pain. How would you rate it from 1 to 10, 1 being very little pain and 10 being the most you've ever felt?
Right now it's probably a 3 out of 10.
Okay. So 3 out of 10. Is there anything that makes it worse?
I notice when I'm like bending over and tying my shoes, it's worse.
Okay.
And then it seems like at night when I lay down, it gets better, but then my nose gets very stuffy and that's distracting.
Okay, so you've also been having sort of nose congestion?
Yeah, I mostly notice it at night. But yeah, that too.
Do you also have a runny nose?
I do.
Okay. Did it start around the same time?
I think so.
Okay. Did you notice any other symptoms, say with your eyes, any itchy eyes, watery eyes, anything like that?
My eyes are kind of itchy and watery, actually.
Okay.
Trying to think if there's anything else. I mean, my throat is scratchy, but also it kind of has this itchy feeling.
Okay.
And that's it.
That's pretty much it?
Yeah.
All right. Is there anything that makes any of these symptoms better?
Not that I've noticed.
Okay. All right. So let me ask you a few more questions. Have you been using any nasal sprays or anything in the nose?
No.
What about in the eyes? Any eye drops or anything like that?
No.
What is your occupation at the moment?
I'm a student.
Okay. Do you come into exposure of any kind of chemicals or any kind of pollutants? Anything that you think might be triggering these symptoms?
Like in my home or workplace? No, I mostly work at home because things are virtual. So, no, I don't think so.
And have you been in this home for a while now?
Yeah, the last 3 years.
Okay. This is probably not that. Do you take any recreational drugs?
No.
What about, do you smoke?
No.
Do you drink alcohol?
Yeah, I have about a glass of wine once a week, maybe.
Okay. How's your diet like lately?
Pretty consistent. I have a smoothie for breakfast and I might have like kale, quinoa, chicken for lunch.
That sounds good.
Yeah. And then like salmon and tuna, and try to get some root vegetables in at dinner.
That sounds delicious.
Yeah.
Have you introduced any changes to your diet over like 2 weeks ago or maybe a little bit before that?
No, it's consistent.
Okay. So nothing there. Alright, so let me just pull up your medical history over here. Okay, any changes to your medical history?
No.
Any changes to your family history?
No.
I do see that your mom suffers from seasonal allergies. She still has that?
Yeah, that's true.
Okay. Have you ever had allergies before?
No.
Are you taking any medication?
No.
What about supplements?
I take vitamin D every day.
Okay. When did you start taking that?
About 3 years ago.
Okay. So definitely not bad. Alright. Do you have a pet?
I do have a cat.
Okay. When did you get this cat?
2 years ago.
Okay.
Yeah.
Any issues with the pet dander at all?
No, not that I've noticed.
Hmm.
None of these symptoms, except for the last 2 weeks.
Symptoms, okay. Have you noticed any issues with like your mouth or your teeth? Anything like that?
Yeah, actually, I thought it was unrelated. That's funny you ask. I've had this tooth pain.
Tooth pain.
It just kind of radiates around my top teeth.
Is it sort of, do you feel that it's like the pain here kind of radiating down, or is it
It's hard to
connected?
tell if it's connected. I thought it was separate, but it might be connected because it falls in line with the same timeline.
Okay. Do you regularly see a dentist?
I do.
When's the last time?
About 6 months ago.
Okay. I can also take a look at your teeth.
Okay, great.
Let's see. All right. Do you exercise?
I do.
Tell me more.
I was working out at home, but my condo recently reopened their pool. So I've been swimming the last 2 weeks since they opened.
Okay, that's interesting. Have you noticed a correlation between your symptoms and the pool at all? Like, does your symptoms get worse when you get out of the pool?
Yeah, it might be a bit worse after the pool. Within the 3 hours after I get out.
And do you use like swimming goggles when you're in there?
No.
Like any kind of protection at all?
No.
Okay, interesting. Have you reacted to swimming in a pool like this before?
No.
Any symptoms? So this is new.
Yeah.
Okay. So I do have my working diagnosis, but I do want to do a few tests just to rule out a few other things, and I do want to do an allergy test on you.
Okay.
So we can I'll do your vitals, and then I'll do the allergy test, and then I'll continue with your other exams, because it does take about 15 minutes for the results of the allergy test to reveal themselves.
Okay.
So we'll go in that order.
Sounds great.
Is that okay?
That's perfect.
Do you have any questions for me right now?
No.
Okay, let's go
Thank
ahead and
you.
get started. Start by taking your temperature.
Okay.
Have you had any fevers, any chills, any signs of colds or flus?
No.
Okay. Put this under your tongue, close your mouth and just hold it. Take your blood pressure. Can you raise your hand all the way up and pump your fist 10 times like this? Thank you. Okay, so you don't have a fever.
Great.
36 degrees.
Okay.
Celsius.
Yeah.
Just gonna raise it up a little bit.
Okay.
You can just relax your arm. It's slightly low.
That's normal.
100 over, around 100 over 7. Go. I'm just going to take your pulse. Alright, all your vitals look good.
Okay.
So I'm not concerned about infections or anything like that.
Okay. Great.
So now we'll go ahead and do your allergy test. I want you to lay face down on the table and we'll get started.
Okay.
Okay, let's take a look here. Let me test. Dust mites. Ragweed. That over it. Definitely chlorine. Histamines are controlled. Not that one. Cat dander just in case. That would be a good idea. Okay. Anything else? Let's see. I think that's okay. Julia, have you noticed any skin rashes, anything new on your skin?
No, I haven't.
Okay. Just going to cleanse your skin with some alcohol. to wipe away any residue, anything on your back, like chlorine, for example. Okay, great. And now I'm going to mark 6 spots on your upper back, like that. Okay. And I want to write down the numbers. So 1, 2, 3, 5, 8, and 20 are the corresponding numbers. Okay. I'm gonna pick out 6 lancets. 2, 3, 4, 5, and 6. Great. Alright, so let's begin. First step, I'm going to apply this control. Just 1 drop. Good. And then the tree pollen. There you go. Cat dander. Then we have number 5. Just dust mite. Okay. You're doing great. Then we have this ragweed. And finally, we have our chlorine. Right there. Good. To grab my trusty disposable box. And I'm gonna just break it. Good. And break. Good. Let's break this one. Good. Okay, you're doing great.
Mm.
Now we're gonna move back to doing some more physical exams, and then after we're done those physical exams, we'll check back on your allergy test, okay? All right. So while we wait for the results of the allergy test, I'll do some exams of your head. I want to start by just examining your face and your head. Any pain here? Press down.
There.
What about here?
No.
What about up there?
No.
Okay. What about here?
Yeah, that's the one.
Okay. Down here?
A little bit there too, yeah.
Alright.
Not there.
Okay. Okay, there's no lesions. There's no signs of trauma.
Okay.
Let's look back here. Just okay. No lesions on the ears. Mastoid process seems healthy as well. No signs of infection. Okay. Okay, I'm just going to kind of squeeze a little bit all over your head here. Let me know if you feel any pain.
Okay. No pain.
What about back here?
No pain.
Long neck. Over here.
No pain.
Okay. Alright. I'm going to look closer at your eyes. One second. You can just look straight ahead. Oh, sorry. There you go.
Thank you.
Okay, just open up your eyes. Let's take a look. Okay. It does look like your conjunctiva is a bit inflamed, and you do have some watery discharge on that side.
Okay.
Let's look over here as well. Yeah, same thing over here.
Okay.
Okay. And then I'm just gonna do some percussion.
Okay.
Any pain there?
No.
Any pain?
No.
Okay. And that?
Yes.
The facial pain that you were feeling?
Yeah.
And over here.
Yeah. Same as the other side.
Okay. What about here?
Mm-hmm. That's right.
Okay. And there as well?
Yeah.
Let me also palpate your lymph nodes.
Okay.
So again, let me know if you feel any tenderness or pain.
Okay.
Start back here.
And then
I'm also trying to notice if I feel any enlarged lymph nodes, which I don't.
okay. No pain.
Good. Also check around your ear. Have you noticed any issues with your ears?
No.
Okay, any like feelings of congestion or
Not
trouble hearing?
Not in my ears.
Okay, good.
No pain.
Just gonna move your head slightly like that. Okay. Okay. Can you shrug up your shoulders? Okay, release them. Okay. Alright, no issues with your lymph nodes.
Okay, great.
Okay, so do you want to check your vision?
Okay.
So I want you to cover one of your eyes. Okay. Let me know which line you can see clearly, like which lowest line you can see clearly. Is it this bottom line here?
No, not quite. The one above it though.
The one above it? Okay.
Yeah.
Go ahead and read it from left to right.
9, 3, 7, 8, 2, 6.
Great. You want to try the bottom one?
Sure. 4, 2, 8, 7, 3, 8. How'd I do?
You did well, actually.
Really? Okay.
Good job.
Thank you.
So let's switch eyes. Okay. And if you could please read that same line but backwards.
Okay. 9, 3, 7, 8, 2, 4.
Wonderful.
Oh,
So 20/20 vision both eyes.
My contacts are working.
Good. So it seems like the watery eyes isn't really bothering your vision so much.
Okay, good.
Yeah. Is that what you've noticed as well for yourself?
Yeah, they do feel kind of painful, itchy, distracting sometimes, but not affecting my vision.
Have you noticed that it does get worse after you swim or like during swimming?
It does seem like that.
Okay. Okay, good to know.
Yeah.
And then now I'm going to check your ears.
Okay.
Okay. Let's start with this one over here.
Okay.
Let me know if you feel pain or discomfort. I can always change my technique.
Okay.
Okay. So the cone of light is present. The interior lower quadrant, all the bony landmarks are present. Don't see any erythema. Don't see any discharge behind the tympanic membrane, bulging. The canal seems clear as well. Okay, great. And is there any pain when I do this?
No, no pain at all.
And was there any pain when I pulled on the top here?
Nope.
Okay, so there's no sign of infection in that ear.
Okay.
So let's check this ear now. Okay, also the cone of light is present at the anterior lower quadrant. There's a little bit more redness over here. Kind of the vasculature of the, on top of the tympanic membrane is a little red. But other than that, it looks perfectly healthy. No signs of cloudiness behind the membrane or any issues there. Okay. Have you ever had any issues with this ear before?
No, actually.
Okay. Well, I'm not concerned
Okay.
with any of those ears, and the fact that you don't have any symptoms either is a good sign.
Okay. Thank you.
Yes. Okay. Julia, now we're going to take a look at your nose.
Okay.
So, just don't mind me. Just going to get inside. I'll try not to go too. Okay, thanks. I do see kind of pale, boggy turbinates, and it does seem quite inflamed in there. A bit swollen. I don't see any ulcers or polyps, which is good, or any like signs of damage in there. Okay. Trauma.
Okay.
So that's good. Let's take a look on this side. It's a little harder to visualize over here. Okay. I would say equally inflamed and swollen on this side,
Okay.
as well as the pale and bogginess that I described earlier.
Okay.
Okay, good. Was that uncomfortable for you?
It was fine.
Okay. I'm just gonna write down some notes about the ears and the nose. Good. All right, Julia. Now I'm going to do what's called sinus transillumination.
Okay.
So we're going to see if your sinuses are in fact congested. So let's start with the frontal sinuses, and if you can see this nice glow, then it means they're clear. That's good. I'll check the other side. Perfect. Okay. Now I'm going to have you open up your mouth so I can see the top of the roof of your mouth. And we're going to check in here as well. Okay. So I'm having trouble visualizing the light through that particular sinus, the maxillary sinus. So let me try this side here. Yeah, I can't quite visualize the light on that side either. So it does look like you have sinusitis or congested sinuses.
Okay.
And it is likely due to allergies, but I'm going to continue by looking at your throat for some more confirmation or ruling out other pathologies, perhaps. Okay. Can you open up your mouth? Good. And say Okay, great. So your tonsils are not enlarged. That's really good. I do see a bit of this kind of cobblestoning effect to the back of your throat, the back of the pharynx. That can suggest postnasal drip. And I see kind of this clear mucus at the back as well. That's a little thick. Okay. Now I do want to kind of tap your teeth, so just tap it here. Let me know if you feel any pain.
Okay. Yeah. Yeah, it's kind of painful.
Yeah? Is it that same? How do you describe it?
Kind of achy. Yeah.
Okay. And what about down here?
No pain.
Okay. And I want to take a more thorough look at your teeth, just to make sure I'm not missing any issues. Take a look at your gums as well, and I want to see if there's any signs of infection. It looks very healthy. You're doing a great job with your dental hygiene.
Okay.
Here. And then just open up your mouth a bit more. Great. Can I also take a look at your tongue? Okay, move it to the side over there. Okay, other side. Then touch the roof of your mouth. Great. Looks good.
Okay.
Start with, I'm going to be testing the sensation of your cranial nerve 5.
Okay.
So that just means I'm going to test your light touch and pain sensation.
Okay.
So light touch will feel like this. Feel that? And pain will feel like this. Can you feel that? Okay, good. Alright, so please close your eyes. This is the instruction. You're going to go ahead and let me know if you're feeling the brush or the point.
Okay.
And you're going to point to the location of where you feel that sensation, okay?
Okay.
So let's get started. I'm just going to brush your hair back a little bit. Okay. So we just feel all of your face.
So that's the brush. Point. Brush. Point. Point.
It's okay.
Brush. Point. 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 point.
Okay, great.
Did I get them all?
Yeah.
Okay.
So I don't suspect any issues with cranial nerve 5, which is the trigeminal nerve.
Okay.
And so there's no nerve issues that I suspect there.
Great.
That's good. So now I do want to check your cranial nerve 1, which is your olfactory nerve. It's your sense of smell, basically. You said you were having a reduced sense of smell, yes?
I am, yeah.
Okay, so do your best to smell these 3 scents that I bring.
Okay.
I want you to close your eyes, though, so that you don't cheat.
Okay. I'll try.
Okay, so let me know what you smell.
Vinegar.
Good.
Honey.
Mm-hmm. Great. So you got them all right.
Oh, good.
So that's good that you still have, it definitely shows that your cranial nerve is intact.
Okay.
But are you able to still enjoy food and, eat?
When my
reasonably?
nose is congested, I can't smell or taste food very well. When it clears up, so it kind of oscillates throughout the day and night.
Okay.
So when it clears up, I'm fine.
Okay, and
Yeah.
right now it's quite clear for you?
Yeah.
Okay, I hear you.
Yeah.
Yeah, I just want to make sure you're not, that you're eating enough and you're being fed. Like, as a student, you're using up a lot of your energy, so
Thank you.
gotta make sure you're well fed.
Yeah.
Good. All right, Julia, so now we can check the results of your allergy skin test, so I'll just have you get back on the table facing down.
Okay.
Thank you.
Yeah.
All right, Julia, now we're back to looking at the results of your skin test, and as we can see, so it does look like you're responding well to the histamine control, which is good. It shows that you haven't taken any antihistamines today. And for tree pollen, you haven't reacted to it at all. It's great, so you don't have those seasonal allergies like your mom does. And cat dander, no allergies to that, so great. You're not gonna have a problem continuing to be with your sweet cat the past 2 years. That's good. Number 5. Which one was that? Let's see. Dust mites. So no issues with dust mites, no sensitivities to that. Okay. And then ragweed. No allergy to ragweed either. And finally, our suspect, chlorine. It does look like you have an allergy to chlorine right here, Julia. So unfortunately, that does mean that you're going to have to avoid going to your swimming pool and try to find a different way of working out for now. And so we can continue to discuss that further and what that might look like. You likely will still be able to swim in saltwater pools and beaches and whatnot, lakes. But it looks like it's a good idea to stay away from chlorine for now, or at least at the levels that they are in the pools. So I hope that is helpful, Julia. It does look like you're falling asleep, so I'll be sure to write all of that in an email and also send you home with a detailed report of all the findings today. And but anyway, you can just go ahead and relax here because you are the last patient. Okay.
Thank you so much.
I'm so glad you came in today. All right, take care now.